Today we'll be going through what you can expect to receive inside a Vertisis V-kit for an IV push. We'll demonstrate how to aseptically prepare your IV push for patient administration. The contents of the V-kit will vary depending on physician's orders. Each kit is customizable per patient needs and physician preferences. Inside each kit, you'll also find an administration guide, pre-calculated osmolarity for commonly prescribed kits, an aseptic technique guide, and an adverse reactions instruction sheet. All supplies necessary to compound and administer the IV are included in the kit. First thing you want to do is lay out all of your medications and supplies in front of you. You'll begin by removing the top seals off of your vial. Open an alcohol prep pad and wipe the top of the vial completely. Wait for the alcohol to dry. Once dry, remove all your syringes from their wraps and attach the needles to your syringes. Select the largest syringe available. This will be your administration syringe. Pull back the plunger on the syringe past the volume needed for your IV push. You will be using the pre-filled syringe as your diluent. Inject the amount of diluent needed as specified in your administration guide into your administration syringe. Keeping the syringe bevel-side up, withdraw the active medication and inject it into the administration syringe. Expel excess air from the administration syringe. Your IV push is now ready to be infused. The following steps are for demonstration only. We'll show you how to attach the IV catheter to the cannula. First, attach a 7-inch extension set to the cannula. Wipe the valve with an alcohol prep pad before attaching the administration syringe. Place the cannula in the patient's arm. Push the final solution as directed by physician or administrative guidelines.